Knee pain is one of the most common complaints that brings patients to see me in my clinic. When I ask my patients what took them so long before they seek medical help, oftentimes they will tell me that they thought their knee pain was not serious. This is what I want to address today. How to know your knee pain is serious so that you can go and consult your orthopedic surgeon sooner than later. I'm going to describe 4 or 5 signs apart from the knee pain that you're experiencing that could indicate that whatever is going on with your knee is something serious. First up is a very swollen knee. I'm not talking about a slightly swollen knee, I'm talking about obviously or grossly swollen knee. Especially if there is a history such as injury just prior to the onset of pain. Because this can indicate serious injuries such as ligament tear or meniscus tear inside the knee. Or sometimes you could have suffered a fracture, for instance a fracture of a kneecap, because all this can cause a massive knee swelling. But if you're in the older age group and there was no history of injury to your knee, a massive swelling could indicate acute flare-up of osteoarthritis or other forms of arthritis such as gouty arthritis or rheumatoid arthritis. The next sign is a very warm knee. When you feel the knee to be very warm compared to the normal side, this is a sign of inflammation. So again, it could be things like acute flare-up of arthritis such as gouty arthritis, rheumatoid arthritis. Somehow osteoarthritis flare-ups are not so warm, but the other types of arthritis are normally very warm. The next sign is if you feel that you cannot fully straighten your knee. This could mean that something is blocking the movement of the knee. Most times it's due to the injury to your meniscus, or sometimes you can even have an ACL tear, which is can prevent your knee from straightening up. So this is also a sign for you to consult your orthopedic doctor. The next important sign is when you feel your knee is buckling or giving way. This is how patients describe it. It is a sensation where you feel that your shin bone is shifting away from your thigh bone. It's a very alarming sensation for the patients. This is known as instability symptom. It's a very serious symptom. And most of the time, this is due to a tear in the ACL or even PCL. These are important stabilizing ligaments in our knee joint. So this is a serious problem. If you do not address it as soon as possible, it will lead to knee damage in future. And then finally, there's if you feel your knee is getting stuck in one position, especially when you're moving about and doing your work and suddenly your knee is stuck in one particular position, this is known as a locked knee. Most of the time, locked knee is caused by a loose body. For instance, a loose piece of cartilage or even a loose piece of bone which has chipped off from the joint cavity, and it lodges into the moving surface of the joint and blocks the movement. And sometimes a serious injury or serious tear to the meniscus. This piece of meniscus can flip over into the joint surface and lock the joint. Again, these are serious signs and you should certainly consult an orthopedic surgeon to determine the source and do the necessary treatment. So these are the couple of signs and symptoms apart from your knee pain that will help you, that can tell you that this is a serious problem and you should go and consult an orthopedic surgeon. When you consult an orthopedic surgeon, your surgeon will, of course, he will take a history, will do a thorough examination of your knee joint, and then he will order the necessary investigation. Most of the time, you will order an X-ray or an MRI scan, which will help to give us an idea of what is going on inside the joint. And subsequently, we will come up with a treatment plan. It could be a non-surgical treatment or it could be a surgical treatment. That part, the surgeon will discuss with the patient and they can decide together. So I hope this information has been helpful. Again, thank you and have a good day.